This is my hero, the person who I looked up to. And now the roles were switched and I was taking care of him and I had to be his hero.
Ted, an Oregon doctor, chose to have an assisted death at home in Portland, surrounded by his family. His daughter Marcy was there, and it was for her, her mother, and ultimately her father, the right decision.
His throat, the cancer, he had stomach cancer, and what was happening, it was starting to work up his system. So he couldn't eat. My dad was a strong person and stronger even up until his death. He didn't want someone to have to go to the bathroom with him to help him with that or to feed him. That wasn't what he wanted. So yeah, he was in pain. He could endure the pain, but it was really more the dignified way that he wanted to leave this earth.
Oregon's assisted death model is the closest to what's being proposed here in the UK. Both require it to apply only to adults who are terminally ill, mentally competent, and have 6 months to live or less, and to take the drugs themselves. But while Oregon cases are reviewed by 2 doctors, in the UK, they would be reviewed by a panel, including a psychiatrist, a social worker, and a legal professional. In Oregon, the drugs are posted to the individual for them to take when ready, whereas in the UK, a healthcare professional would bring them to the day of the planned death. Dr David Grube is a retired Oregon doctor who's assisted numerous patient deaths. He has no regrets. A doctor's job, he told me, is to listen to his patients' needs. Ever feel conflicted about helping a patient to take their own life?
Never. And it's, especially...
Never? You've never been conflicted?
I've never been conflicted. I've attended a number of them. Each of the ones that I have attended has been almost sacred, if you will. It's hard to explain, but with the family there, with the family dog in the bed, with the music playing that they want, everyone's sad, everyone's crying. It's not a joyful moment, but in a way it's a kind of a sacred moment.
One of the fears that is expressed is by introducing assisted dying, you erode quality palliative care.
The role of the doctor who's attending the dying patient should be one of listening and paying attention to what the needs of the dying patient are. And it's eroded when the patient can't trust the doctor. When I've seen a patient who has tried to talk to a doctor about aid in dying, and they go, well, I won't do that. I'm opposed to it. Well, that doesn't enhance a doctor-patient relationship. It would be enhanced when the doctor said, let's talk about why you want to ask that.
Since the last vote, the UK's assisted dying bill has been significantly revised. High Court approval is out, replaced instead by an expert panel. The rollout has been delayed until 2029 to give the NHS time to prepare and for new safeguards to be introduced to protect vulnerable patients. But opposition campaigners, including medical bodies, say there are still concerns over mental health provisions and the risks of coercion. Dr Amy Proffitt is a palliative medicine consultant. She says the Oregon model raises many, many questions.
But it's far from a safe system. And the majority, 80% of the people that have assisted death, have government insurance with Medicaid or Medicare, suggesting that the vulnerable in society are not worth it. Put that into our NHS, and what does it say about us as a society? Those with disability, those with learning disabilities, those with social deprivation. I think it's deeply dangerous for the bill that's being proposed, and it needs to be scrapped and we go back and look again.
Ted's family are grateful that they live in a state where his assisted death was allowed. It's a choice they would make again if they had to. Now this country must soon decide if that same choice is made available over here. Asish Joshi, Sky News.